Hi, my name is Kaylee Romano, and I'm sharing my case study assessment. A little background information about my patient. She's a 67-year-old woman diagnosed with type 2 diabetes. She's retired from a semi-active job. She spends most of her days at home with little physical activity and recently noticed abdominal symptoms including urination, free urination, fatigue, and slow wound healing, includes a poor diet. Her dietary data within the 24 hours includes at 7:30 a.m. for breakfast, she had 1 cup Fruit Loop cereal with 1 cup of whole milk, half a cup of orange juice. At 11 a.m. she had 1 bagel and 1 12-ounce can of Coke. At 12:30 for lunch, she had 1 hamburger with toppings, a serving of fries, and 12-ounce can of Coke. And at 2 o'clock, she had 2 cookies and 1 12-ounce can of Coke. And at 6:30 p.m., she had 1 serving of chicken breast, roll with butter, and half a cup of peas and 1 12-ounce can of Coke. Her diet calculations include that she eats about 1,688 kilocalories per day, and she needs approximately 1,686, so she is reaching her intake. However, she's eating 48 grams of protein, which is about 11.3% of intake, 271 grams of carbohydrates, which is 64.2% of her intake, and 46 grams of fat, which is 24.5% of her intake. So as you can see, her carbohydrates are super high. Her biochemical data includes a couple of tests we ran. So her fasting glucose test showed that she was high at 147 milligrams per deciliter. Their blood sugar test 2 hours after her meal was 192 milligrams per deciliter, and that was also high. It was indicative of a very high carbohydrate diet and non-insulin dependent type 2 diabetes. So her LDL was 145 milligrams per deciliter, and her HDL ratio was 42 milligrams per deciliter. So her ratio was high, and her blood pressure was also 145/92. These are both indications of a diet consisting of unhealthy fats and low fibers. Her anthropometric data includes her height. She was 5'6", 180 pounds. Her TSF, 19 millimeters. MAC, 25 centimeters, and her MAMC was 1903 centimeters. So you can tell she found in the mid-range of her percentile, but it was a little bit high here. Values indicate the JS has an average amount of muscle and adipose tissue for a woman her age. However, her MAC is larger than 75% the woman her age. This correlates to her high fat and her high carbohydrate intake. So some observations that we noticed about her: she was overweight, she seemed fatigued, her hair was non-pluckable, and her skin did not show any signs of paleness. So after assessing the patient, she's assessed to be a type 2 diabetic who is overexposed to bad fats and carbohydrates based on the following information: the excessive consumption of carbs in her diet, 64% of daily intake, inflamed lab values, the blood sugar, HDL, LDL ratio, high blood pressure, substandard anthropometrics, and abnormal clinical observations. For the medical nutrition therapy, she's going to be on a strict carbohydrate diet with 1,686 kcal intake. Replace Coke products for sugar-free replacements or water. Reduce carbohydrate intakes for 50%. Less fat in her diet, reduced from 24.5 to about 20%, and increase protein consumptions to 25 to 30%. The plan of action: she needs to take responsibility for her own health. She'll be thoroughly informed on meal planning, type 2 diabetes, and the impact of diabetes and cardiac health. And then we're going to keep up with her through telephone or personal visits once a month for 6 months to evaluate JS's nutritional progress.